For more than half my life, I've had major depressive disorder and social anxiety disorder. As a teenager, I was in and out of hospital more than a half a dozen times for suicide attempts, increasingly dangerous suicide attempts. And I think it was through that experience that I was able to learn more about myself, certainly, and what my needs were, but also how broken, how truly broken the system is.
It's Mental Illness Awareness Week, and this year with the current pandemic, mental health advocates say people are feeling a lot of anxiety these days.
Ever since back in March, I've been talking about and worried about a coming echo pandemic of mental health problems and illnesses. And I don't think it's coming anymore. I think we're already in it, actually. I think we're starting to see spikes of depression, anxiety, even tragically suicide.
You know, we used to talk about mental health like there's some people who have some challenges and we need to support them. And we all have challenges now. If you are not feeling anxiety now and then, if you're not feeling a hint of depression now and then, you're just not paying attention. You know, it is, we all now feel that we do have some struggles, and we know that this is going to be part of our world going forward.
Mental health advocate Mark Henick says this has become much bigger than a visit to the doctor.
I think the government definitely needs to respond in a more forceful way at every level, the municipal, provincial, and federal level. Now, there have been promising announcements, for example, increases in internet-based cognitive behavioral therapy, which is a wonderful evidence-based program that will help a lot of people. That said, however, we need to think about rebuilding the mental health system in a way that actually meets people's needs better. You can't fix a system that was never built well to begin with. And I think that's partly what we're facing here, that the foundation is faulty.
As for what people can do, Toronto professor Steve Joordens says he's developed a free online course for those dealing with anxiety.
It's focused on anxiety, this course. So I describe how anxiety comes about. And then I have sort of two classes of tips. So one is we talk about how you can formally learn to summon relaxation. Relaxation is the opposite of anxiety. You can't be both anxious and relaxed at the same time. So if you want to get rid of anxiety, the best way to do it is to strengthen relaxation, to kind of summon that relaxation response. Third part of the course is a little simpler, and it's about becoming mindful of how the environment affects us. I think this is a time when we need to think of the physical training side of mental health, and that is making people understand, like, where does anxiety come from? It's just a biological process. It's a biological reaction in our body. And so when we understand that, we can start to now say, okay, can I manage this?
For more information on this online course, you can go to our website, citynews.ca, under Extras. For City News, I'm Stella Acquisto.